Hi learners, and welcome to the last mini lesson for the nervous system. In this video, we're going to talk about procedures and pharmacology. Let's start with diagnostic procedures. A lumbar puncture is sometimes known as a spinal tap, and we do this to remove CSF or cerebrospinal fluid. We insert a needle into the subarachnoid space, usually around the level of L3 or L4. And we look for things like white blood cells that would suggest an infection, or high protein levels that would indicate damage to the brain or the spinal cord, or blood that would suggest a hemorrhage, or sometimes just tissue damage that would suggest a traumatic tap, meaning damage that occurred from doing the lumbar puncture itself. Electroencephalography records the electrical activity of the brain, and we use that to diagnose seizure disorders, sleep disturbances, and brain damage. Computed tomography, or CT scans, generates images of slices of the brain to diagnose a huge, wide variety of diseases, including strokes, tumors, ischemia, birth defects, all kinds of things. Magnetic resonance imaging, or MRIs, generate highly detailed pictures of the brain and the spine, really any part of the body, and is also used in a wide variety of disorders like strokes and tumors and myelin sheath damage. However, it doesn't expose the patient to radiation like a CT scan, but instead uses strong magnetic fields to generate these images. Magnetic resonance angiography is similar but uses a dye to produce detailed images of blood vessels in the head and neck during an MRI. In evoked responses, sensory stimuli like pictures or sounds or objects to touch are used to activate specific areas of the brain, and then the responses are evaluated. Electromyography provides information regarding disorders of muscles, peripheral nerves, and the neuromuscular junction by placing small needles into a muscle and recording its electrical activity. Nerve conduction studies measure the speed at which nerves conduct impulses to and from the brain. Cerebral angiography and cerebral arteriography use dye to produce images of blood vessels that are blocked or have aneurysms or malformations. These are really helpful to detect blood vessels that are partially or completely blocked, or aneurysms or AVMs. Remember, those were arteriovenous malformations. They are particularly helpful in determining the site of bleeding in hemorrhagic strokes. Color Doppler ultrasonography uses high-frequency sound waves to evaluate TIAs, those were mini strokes, and the risk of full-blown strokes. These specialized ultrasounds use color to show blood flow through the arteries of the neck or the base of the brain. Echoencephalography uses ultrasound to produce images of the brain in children under the age of 2. It only works in young children because their skulls are thin enough for the waves of the ultrasound machine to pass through. Positron emission tomography, or PET scans, are metabolic scans that involve using a radioactive tracer like glucose that's either swallowed or injected or inhaled, and then taking images of the body part being studied to see which tissues are most metabolically active. Certain diseases and disorders cause tissues to be more active, so they'll show up brighter on the PET scan. Myelography is a type of X-ray that uses a special dye injected into the subarachnoid space to look for abnormalities of the spinal cord or spinal nerves. These are some therapeutic procedures. Craniotomy simply means the surgical removal of part of the cranium or skull to expose the brain for surgery. Cranioplasty, plasty means repair, so cranioplasty is repair of the cranium or the skull, and this usually is a result of the craniotomy. Deep brain stimulation is placing electrodes deep into certain areas of the brain to deliver electrical stimulation, and this is usually done for the treatment of tremors resulting from something like Parkinson's disease or multiple sclerosis, or to treat severe seizure disorders. Endovascular coiling is a procedure done to block blood flow to an aneurysm to prevent the aneurysm from rupturing. Thrombolysis is the procedure done to dissolve a clot that's causing an ischemic stroke. The suffix lysis means to dissolve or destroy, and the root word thrombo means clot. You may have heard of clotbuster drugs like TPA or tissue plasminogen activator. These drugs must be given within 4 hours of a stroke, and the patient must meet very strict criteria to receive the drugs, but they have a pretty good success rate in restoring blood flow to the ischemic areas. Carotid endarterectomy is the treatment for TIA and sometimes CVA. The carotid arteries supply blood flow to the brain, and if they become significantly blocked by plaque, those plaques must be removed. In this process, the plaques are surgically removed from within the carotid arteries. Okay, now let's talk about pharmacology for the nervous system. Stimulates excite the nervous system and cause the release of dopamine, leading to pleasurable effects. And these include things like caffeine, nicotine, amphetamines, and cocaine. Sedatives have the opposite effect and quiet our nervous system and act on the sleep centers in the brain to induce sleep. Sedatives include alcohol, barbiturates, and anything that puts our brains to sleep, basically. Inhaled anesthetics are more powerful than sedatives, but act very similarly. Opiates depress sensory nerve pathways and are mainly prescribed to reduce pain, but can occasionally be given to control coughing as well. Opiates also act to depress nerve pathways that control breathing and intestinal mobility, so they have the side effect of depressed respirations and constipation. Opiates include drugs like morphine, codeine, heroin, methadone, and oxycodone. Opiate antagonists prevent opiate actions and are used in drug overdoses. They include naloxone and naltrexone. An antagonist is a drug that works against something, so anytime you hear the term antagonist, it's blocking the effect of something. Tranquilizers act like sedatives but do not have the same sleep-inducing effect. Tranquilizers include drugs like Valium, Xanax, and Librium. Antidepressants increase the amount of serotonin at the synapses in order to improve a person's mood and include drugs like Zoloft and Prozac. Antiepileptics are drugs used to control seizures, and these drugs work to prevent stimuli from passing across the synapses. The two most common antiepileptics include phenytoin, which is Dilantin, and carbamazepine, which is Tegretol. Psychedelics distort sensory perception, especially sight and sound, and include drugs like ecstasy or MDMA, angel dust, which is also called PCP, and LSD, which is sometimes called acid. These drugs increase the amount of serotonin in the synapse and also act like amphetamines. Marijuana's active ingredient is tetrahydrocannabinol, or THC, which produces the drowsiness of sedatives and the pain-dulling effect of opiates. It has many medical uses and has become legal for recreational use in several states. Okay, the last section of this part of the text talks about pain management. Pain lasting longer than 3 months is said to be chronic. Pain that has a sudden onset and lasts a short period of time is said to be acute. Pain management is a specialty of anesthesia, and anesthesiologists are the doctors that are able to treat chronic pain, although some general practitioners also treat chronic pain. Medication is the cornerstone of pain management. There are 3 levels of pain severity: mild, moderate, and severe, and treatment can be based on the 3 levels. Mild pain can be treated with analgesics like NSAIDs, which are non-steroidal anti-inflammatory drugs. Moderate pain can be treated with opiates or opiate combinations like Percocet and Vicodin. Opiate medications are unfortunately very addictive and frequently abused. There are many restrictions put in place on prescribing opiates and refilling prescriptions. Severe pain can be treated with higher doses of opiates like morphine and fentanyl. These high doses can be given orally, IV, or by transdermal patch. Think about a cancer patient who's in chronic pain and requires high doses of opiates to control their pain. Other types of pain management that do not involve medication block pain signals at the source. This interventional pain management is increasingly used for pain originating in the spine and involves epidural nerve blocks, facet nerve blocks, radiofrequency nerve ablation, cryoneurolysis, and spinal infusion pumps. Phantom pain follows the amputation of a limb, and it basically results from stimulation of the remaining portion of the sensory pathway of the nerve from the limb and is interpreted by the brain as coming from the original limb that has been removed. Referred pain is an interesting phenomenon, and it means pain from an internal organ is felt in an area other than where the pain originates. It's interesting because the referred pain follows a very specific pattern pretty consistently. You've probably heard someone has left arm pain when they're having a heart attack. You see that all the time on TV. That's an example of referred pain. There's nothing wrong with the person's arm. The pain is coming from ischemic heart muscle, but the pain is being experienced in their arm. I had a patient once in the ER who was knocked off her bike by a car. She came in a few hours later complaining of left shoulder pain and wanted to be checked out because she thought she injured her shoulder when she fell. So I brought her into triage and I was checking her over, and I noticed she looked a little pale, and I took her blood pressure and her pulse, and her blood pressure was really low and her heart rate was really high, so I got really concerned. I rushed her to the back and I called the doctor over right away, and sure enough, the doctor came over, ordered some tests, and she was in the operating room within the hour with a ruptured spleen. Her shoulder pain had nothing to do with her injured shoulder, but was actually referred pain from her ruptured spleen. So it's really interesting how the brain interprets the pain signals and where they're being transmitted from. Okay, so that wraps it up for this chapter. As always, I thank you for your attention, and I will see you in the next video. Thanks!